So this is me now talking to my grandfather. So can you share a little bit about yourself and your background?
Yes, I'm a physician with a specialty in infectious diseases, and I spent my career in academic medicine, uh, rising up to be a professor at the Mount Sinai School of Medicine for over 37 years, and recently retired from academic medicine, and I'm presently a consultant to the New York State Department of Health.
Did you first hear about AIDS? And do you know where were you?
First heard about it from academic writings. In 1981, there was a classical paper in the New England Journal, uh, two papers actually, which didn't know it was AIDS, but they knew it was an immune deficiency disease that occurred in two different groups. In one group were intravenous drug addicts, and the other group were male homosexuals. So we didn't call it AIDS then, but these were people who came down with strange infections uh, only because they had an altered immune system. Normal people would normally not come down with those kind of infections. So I guess it was 1981 and I was at Mount Sinai then.
Okay. And what were your first reactions to the virus, or how about how it spread or who it was impacting?
Yeah, well, initially it was not known how it was spread. First, they thought it was mainly in drug addicts, and then they thought it was also in gay homosexuals. Um, I know you heard from Omar about how some of these people were mistreated, had difficulty with jobs and so forth, but I wasn't really involved with that. I was involved with taking care of these patients who got sick because infectious disease, we didn't just take care of the normal infections that you and I might get, but these overwhelming infections that the gay and the drug addicts developed. So until there was any testing, all we knew is that these two groups were the major groups at risk. Obviously, they spread it to normal people, uh, both from sex and sharing intravenous needles.
Okay, yeah, and that kind of brings me into my next question, which was, what role did you play in, I guess, like, I wrote solving the AIDS epidemic, but I guess in your case, like, I guess just like dealing
No, I didn't. I
with it,
didn't.
living in it.
I didn't play any role in solving it. I only played a role in taking care of these patients uh, when they developed these infections. So,
So were you
they were
the,
very sick, these patients, because back in early days,
Mhm.
there was no treatment for, even though we didn't know the cause of that it was due to a virus, the infections they developed, we had to treat were difficult to treat. So my role was treating these difficult infections, not initially treating the HIV virus because we didn't know it was an HIV virus early on.
Yeah, so you were the doctor that people would go to, I guess, if they were
Right. Our
doing
group
this.
mainly, right. After a while, people specialized in specifically taking care of HIV patients. I did not specialize in taking care of them, but when they got infections, in other words, once there were testing done and once there were early drugs done, there were doctors who mainly took care of HIV patients, some colleagues of mine. I was more that when they developed bad infections because they had HIV, I saw the patients at that point.
Around what year was this? Do you know?
Yeah, in the early 80s. So this is
Yeah.
1982,
hmm
you know, and then obviously in the mid 80s and the late 80s and so forth.
Yeah. And so in my class, we watched this documentary about activist groups such as ACT UP and how they, like in the beginning, in the early 80s, they really just wanted a cure, they wanted a solution,
Right.
they wanted help. And so, did you ever face any backlash, or did you ever notice the
No,
impact
no, but
that this group had?
empathize with them in that. And as you heard Oma say, they knew that they possibly were doomed. And so they wanted the therapy, even though it hadn't passed, the multiple tests that the Food and Drug Administration, the FDA, usually requires. So I was believed in that, but I didn't play any role in requiring that. I mean, I was not one of the doctors who marched or advocated for that, but I believed in it myself. Uh, you
And
know,
obviously, New York was such a big like
yes.
place in terms of
Right.
everything going on. I was just wondering if you ever noticed or like ever interacted with people that weren't in New York in response to AIDS, or if you
No,
noticed what was
mainly
going on.
I mainly only interacted with the patients and their loved ones, which were often spouses, boyfriends, girlfriends, etc. Sometimes they were, sex workers who got infected, who we took care of. So early on, when there was no treatment, the only thing you could try and do was treat these infections they developed, and that's where I was involved. Once the treatment came along, then I did not specialize in taking care of HIV patients. There was specific infectious disease doctors who were my colleagues who took care of these patients.
Yeah. And so I wrote down this question, if did you know anyone with AIDS? And so I'm wondering, like, was it just the
Not
patients you were
personally.
treating?
No,
Okay.
no, I didn't know anyone. I only knew the patients we treated. Let me think for a minute.
Hmm.
It was long ago.
Yeah.
Um, no, I can say thinking I didn't know anyone other than patients that we saw with
Hmm.
HIV. Um,
And so obviously with ACT UP and everything, they're like kind of demanding treatment from the government and asking the
I,
government to do this, and this.
yeah.
I'm just wondering, was there ever a point where you personally disagreed with the government and how they were
Yeah,
handling
well,
the.
initially, uh,
Hmm.
I disagreed, not exactly with the government, but we felt that at least early on they should be more careful with people who were allowed to donate blood, uh, that they might contaminate, that maybe, uh, maybe it doesn't sound fair, but they shouldn't have allowed uh, either high risk groups like gays and drug addicts to be able to donate blood or serum. So I was for that, but it would only be in a conference room where I could voice my opinion. I didn't go out in the streets and act up or do anything. Uh, but I was concerned about uh, the blood supply. And you heard Oma say also that, you know, the hemophiliacs or anyone who got blood or plasma or platelets, any of these blood products, they had to screen better until they had a test, obviously.
uh, and so did you notice like I guess kind of a transition or an improvement when from like when there wasn't any treatment or like ARTs were still being developed to like when they were implemented? Mm.
Yeah, well, obviously, when AZT was first came along, I mean, it was not such a great drug, but it was the fact only drug that was around. Uh, so it was somewhat miraculous, but it's still a lot of people who took the drug quickly became resistant to the drug. So it wasn't a cure-all. I mean, you needed that plus other drugs as it went on. And so, yeah, my recollection is that it made a dent and it gave hope. That was the most important thing. It gave hope to these poor patients, and the fact that at this time multiple drug companies were all looking for other drugs besides AZT. You know, and obviously those drugs came along and the therapies then became multiple drug therapies initially once the other drugs, the protease inhibitors, were developed. Um, so,
And yeah, and I asked Oma this, and I know that like art was a big part of activist groups, and there was like movements such or like pieces of work, I guess, or posters, such as the like silence equals death poster. I'm wondering if there was any like piece of art that like or poster or any like sort of slogan or anything that stuck
no,
with you from that time.
not
No.
that I can recall. No, maybe Omen probably knew more about this than I did. I mean, with the posters and the
Yeah, I
art.
just didn't know if you were ever like on your way to work and you'd see
No,
something or
no, it's
mhm.
not like war bonds when they had
Yeah.
World
Yeah,
War,
I get
right?
that.
No. Um, but there
But
were in New York, there was some obviously demonstrations and things, and especially many of the hemophiliacs. And there were demonstrations against one of the doctors at Mount Sinai because the hemophiliacs were getting infected, and so
well,
they were concerned.
yeah. Wait, could you tell me more about that? Just they
Yeah, well,
just demonstrated.
I don't remember all the facts. You could maybe
Mm-hmm.
Google it if there's
Mm-hmm.
anything about hemophilia, HIV, and Mount Sinai and demonstrations. Use those four words: hemophilia, demonstrations, HIV, and Mount Sinai in the 1980s. And you might see, I don't exactly, I didn't personally see the demonstrations, but I know something went on and it had to do with the hemophiliacs. And by the way, after you do it, let me know what you found
Yeah.
because I know it was an issue. It was an issue. But I think it was before they obviously had tests for HIV. So I don't remember all the circumstances about it, but I know, I'm sure it's something you can Google.
Mm. And then I wanted to know, is there any like specific story that you could share just like from any time where it just like really stuck with you as like a moment in this period in this epidemic and like
Oh no,
related to the
just
research or anything?
yeah. Our at Mount Sinai, we were not involved, and none of my colleagues were involved with any early on particular research.
Okay.
So none of that. Um, Plus, me personally, uh, I drifted off to a different part of infectious disease, dealing with infections in transplant patients, and actually became the director of transplant infectious disease. So if anything, I drifted away. I saw
Mm.
these patients when I was on weekends, let's say on call, but I was not their main doctors. And in fact, I had a few patients that I had seen. Oh, the other thing I can tell you, yes, I have a story of a patient. Because early on, he was married and he was a surgeon. And surgeons, sometimes get their fingers cut when they're operating and so forth. And so he initially came in and saw me and had HIV, but it turns out that he claimed it was the surgery, but it turns out he was a homosexual. He was gay, even though married with children, but he was afraid of the stigma, right? So the homosexual early on, right? We thought, wow, he got it at the time of surgery. So surgeons might not want to operate on patients with HIV because they can catch it if they, by accident stick themselves. So there was a lot of stigma. I think you should explore that, the stigma against homosexuals. And I know, like Oma said, there was fear with them at the workplace. People didn't want to be associated with them early on, and so forth. So I remember this one patient.
Mm.
And then when he actually admitted it, came out of the closet, I, as AIDS went along and they had some drugs, I transferred him to one of my colleagues who specifically focused on HIV while I was focusing on patients with transplants and so forth.
Yeah.
But the stigma was something that you might get interested in. Uh, It really was a tough time for people who were gay. Uh, it's always been a tough time if you go back 40 years to the 80s. But certainly when HIV came along, it was even worse. Uh, because we wondered, how did he catch his infection? Because initially we thought he was heterosexual only. And so we thought it must have happened at surgery. Anyway, so
Yeah. Yeah, that was a big aspect of our class was learning about the stigmas surrounding it and even how like sometimes doctors wouldn't even treat people with HIV
correct.
because of the stigma
Yeah, that's a
surrounding
good point.
it.
That's
Mhm.
absolutely true. There were surgeons who didn't want to operate on these patients because, as I told you, they often get these little sticks. And but as I recall from a lot of research, it was almost very, very, very rare that any surgeon ever got it from operating on a patient. Very rare. But initially, they were worried. I know you spoke with Omer about how it was transmitted, that it maybe if you kiss somebody, you could get it, and so forth. So there was a lot of fear. Maybe you cough or sneeze. And so there was like that stigma was very difficult for these fellow men and women, so forth. The other
Mhm.
thing that, oh, it's medical, you may not be so interested,
Well, that's
but
okay.
I'll tell you anyway, because early on, uh, when men had HIV, men could spread it to women with vaginal intercourse. All right. So it was rare if women to spread it to men unless the men had other, like ulcers, things like herpes can give you an ulcer, so they could have penile ulcers. Syphilis can give you ulcers. So it was very rare initially that women could give it HIV to men, but men could give it to women because the women didn't need a sore. They had a big vagina, and so it was spread. And obviously with males, it was by rectal sex. Uh, and the body wasn't prepared, right, to get rid of HIV virus. It would pass through.
Mhm.
So initially, women were concerned about obviously having any kind of sexual, even with their spouses or with anybody. They were nervous because they were at great risk, whereas men were at less risk if they didn't have the ulcers and so forth. So you could see if a woman had it and it was in the vaginal secretions, if a man had it with sores on his penis, or it could be spread from women to men. So to sum up, initially very easy to spread from, if they had it, from male
Yeah.
to female, but rare to spread it from female to male.
Mhm. Yeah. And then I was wondering if you have like any of those reports from early on or anything that you might have contributed to or anything that you
Not really with HIV. Some of my colleagues were on those original papers. They
Mhm.
were taking care of these patients with these strange infections. But not me. I wasn't. I I mean, I was there for the AIDS epidemic, but if in history, you could say I didn't play a big role. These colleagues of mine who saw these
Mhm.
patients didn't know, of course, they had HIV. They just knew they had weird infections in 1981 in that paper that was written.
Mhm.
So I was not
Yeah.
wasn't my thing.
Mhm. Yeah, because I know that Oma was saying how she tried to go to the special collections in New York and they
Yes,
like didn't have these documents anymore. But obviously this is such like an important history to preserve.
sure.
And so I'm
Yeah,
wondering if you ever
well,
like thought, have reflected back on that, especially because for me, I lived through COVID, obviously, so I'm able
sure.
to like make connections to that. I don't know if that was ever like something you made a connection to or
Yeah, yeah. Well, it was a devastating thing, COVID, until they got some of these drugs like Paxlovid.
Mhm.
Um, Yeah, it's almost the only difference is that COVID is a short-lived disease. You get it, you get better. HIV, you get HIV, it's almost forever.
Mhm.
How do you without drugs for most people. Now, certain things like, believe it or not, there are people that have HIV but don't have AIDS. AIDS
Mhm.
is when you
Yeah.
have all these other, and some of those people the reason that one of the suggestions is in order for the HIV virus to enter your bloodstream, I mean, to enter a cell, it has to, there's a marker on your own cell. And so if you're missing that marker, and there was something, I think it was called CCR04, I forgot the name of it. It was missing on your T cell. And so that the virus couldn't infect you. So meanwhile, it would be floating around in your blood, but if it doesn't get into your cells, so make a note, CCR04, I think that was the site that some people are missing, which means they could have HIV floating around and yet they're not sick. Obviously, they can spread the virus, right? By sex or by giving blood. But most people with HIV didn't have, they had this marker on their cells and the HIV entered and caused disease. So there are a few people around that you wondered if they had HIV, why didn't they get AIDS? And this was the reason they probably missing this CCR. I think that's what it was, CCR04. I could ask
Yeah.
my, I want to ask my phone. So
Okay.
I asked Google. Hang on.
Mhm.
What's the marker on T cells, CCR04, that may protect from HIV AIDS?
The CCR5 marker, or CC chemokine receptor type 5, is a key co-receptor on CD4 plus T cells. It's often downregulated in people who naturally control HIV, which protects their T cells from infection and prevents AIDS. For medical advice or diagnosis,
CCR5.
consult a professional.
CCR5 is the key receptor. So if you don't have that CCR5, you were protected. So they were very rare. But before they found any drugs for HIV, they wondered why you could have, when they had the test for HIV but didn't have the drugs, they wondered why some people didn't get HIV, didn't get AIDS. And this was one of the reasons about it. But again, I was not involved with this research, but was aware of it and so forth.
Mhm.
Um,
Yeah. And this conversation kind of reminds me of a question I we just had were asked in class recently, which was how do you see I don't remember the exact wording, but it was how do you see an end to the AIDS epidemic? And it was just to bring up discussion. Because my friend and I talked a little bit about COVID as well. So I don't know if you, because a big part of our discussion, because this was a global history of AIDS. So we looked at AIDS in Vietnam, Brazil, Spain, all over. And we looked at in particular government initiatives, for example, which were and I guess in somewhat the extent to which these governments took action or didn't. But I think it was just an interesting discussion we had. I don't know if you have any comment on that because with you saying obviously COVID was a much different sort of process
but
and
initially, it was a little like HIV in that there was
yeah.
no treatment and so forth in the
Hmm.
beginning, and
Yeah.
so for certain patients it was deadly. Uh,
Hmm.
as I said before, but for those who recovered, HIV, other than drugs, there was no way to reduce the level of HIV in the body. Uh, I can't really comment because. All I remember that there was a lot of work because Africa was probably considered. I don't know if you cared or thought about what they said was the origin of the HIV virus. That
Yeah.
it probably
Hmm.
came from baboons and it was workers. It was the simian virus, meaning from apes. That there's an SIV instead of HIV. That's human immunosufficiency virus. SIV was simian. They think that maybe it was a mutation from the simian virus in baboons. Now, how did males get it? They ate baboons, they chopped them up, they got blood on their hands, they had sores, and so it probably originated in Africa. And so I remember that I guess the US was very good about way back then trying to help people in Africa with AIDS with as best they could. Uh, obviously there's no vaccine like there is for COVID for HIV. There's never, they've tried to develop one, but at least as of now, it's probably
Yeah.
not ineffective.
Yeah. Yeah, that was something we talked about. And I don't know if you would have any comment on this, but like when we started my class, like one of the very first articles I had to read for this class was about how there's currently an AIDS outbreak in Maine, in Bangor, like right up the road, 40 minutes from here. I don't know if you have any like
Now,
reaction.
now they said there's an AIDS outbreak.
Yeah, in 2026, there's like maybe 7 or 8 people
But
confirmed.
were they drug addicts? Do you know?
I I don't know for sure. But
I'm going
it's
to
just
guess
interesting.
because the gays and homosexuals, the ones that are intelligent, know that there's drugs and there's certain drugs that can reduce the count of the HIV virus, so it's not spread. You sometimes hear the ads on television, reduce the count to, less, almost zero, and so
Yeah.
you're not contagious. I'm going to guess it's an outbreak about drug addicts, uh,
Hmm.
because that's most likely the thing. Sharing of needles. That's a big thing. This, at least uh,
Hmm.
with the drug
Yeah.
addicts, the intravenous drug addicts share needles. Obviously, if they had sterile needles, right?
Hmm.
If
Yeah.
and you use a drug, but if you share needles and the other person had HIV, one
Hmm.
of the things that the governments wanted to do was to give out needles, sterile needles to the drug addicts. But then people said, well, that'll increase they'll still keep being addicted. They're just not
Hmm.
infected with HIV. But some of the communities across America
Yeah.
wanted to give out sterile syringes and needles and condoms, always condoms, of course, but
Hmm.
sterile needles. Uh, so I was aware of those, uh, plans with the condoms and the needles and
Yeah.
syringes, but didn't
Yeah.
play any, I didn't play any role. I was busy
Yeah.
taking care of the transplant patients.
And that reminds me of how like Trump, I think it was last year, like was cutting like I
Yes,
think he
that.
cut like funding for like um the PEPFAR program as well. So we were talking a lot also in my class about like what that future might look like. Because then that like PEPFAR is the president's emergency plan for AIDS relief,
Yeah.
um, and that sort of thing. So that was really interesting. But
Oh, yeah, and he cuts
yeah,
lots and lots of things. So terrible, I think. But
yeah,
that's politics, right? We
yeah,
can only comment on it. We can't do anything about it until he leaves office. So it gets,
yeah. Did do you feel like you were like Mount Sinai? Did you guys ever feel like any pressure from the government, or was it
no,
more just like
none,
you
none,
know? Okay.
no,
Mm-hmm.
no, not me, not Mount Sinai.
Mm-hmm.
Except that one issue you're going to look up with the hemophilia uh, when there
Mm-hmm.
was a demonstration. Well, I remember someone saying they're demonstrating outside. I didn't go outside when it happened, but I'm sure
Okay.
it'd be written up because I think it made the newspapers. In fact, take a
Yeah.
look now. I'm going to take a look too.
Yeah.
I'm going to
And um.
hang on. I asked.
Okay. Did you ever like also know anyone in the FDA at this time, or was it more you were
No,
like at
no,
Mount Sinai? Because I know they were like being,
no,
they had some issues with backed up.
no. Wait. Tell me about the AIDS demonstrations and hemophilia at Mount Sinai Hospital in the
Okay.
early AIDS epidemic. Let's see what it says.
And I will say we do have
During the
10
early
minutes
AIDS epidemic,
remaining.
Mount
Listen,
Sinai Hospital, including Beth Israel, was a key location for HIV care, research, and activism, especially concerning hemophilia and HIV. For medical advice or a diagnosis, consult a professional.
Yeah, I will do more research on this
yeah,
and I can maybe write something about it.
let's see. Anyway, it's let's see, wait.
Okay.
No, Mount Sinai. I'm just
Hmm.
looking about
Yeah.
Mount Sinai, Beth Israel, and Count AIDS for the first time. 33-year-old West German who lived in Haiti. I don't,
Hmm.
obviously, I don't remember that. Um,
Yeah.
yeah, I just, it just was
Hmm.
a somewhat of a demonstration dealing with hemophilia.
Yeah. And was the demonstration like done by hemophilia? Yeah, that's what you
Yes,
said,
yes,
right?
yes,
That was the
yes.
group or the
Right.
like.
But I think they were concerned because they were coming down with HIV. So maybe Mount Sinai wasn't not testing the blood, maybe not checking the blood clear enough. I don't remember the reasoning of why they
Hmm.
specifically came to Mount Sinai. Um, so, but
Okay,
it didn't
yeah.
last very long. I mean, it was short-lived, as I recall. Um,
Hmm.
but I wasn't
Yeah.
involved with the HIV patients. I
Yeah,
mean,
I'll
with
try
the
and
hemophilia patients.
yeah, I'll see what I can find.
Yeah.
Um, yeah, that was pretty much all I had.
Yeah.
Thank you again
Okay.
for
Sure. Yeah, yeah, of
meeting with me.
course.